Welcome back to the Wholesome Pharma channel on the Seavine News Network. I'm your host, Linda Forsythe. Today, by popular demand, we have brought back Dr. Erik Koda, who is a family practice physician and also integrates acupuncture into his daily practice in addition. We also have brought on one of his colleagues, Dr. Jim Halvorson, who is a doctor of chiropractic medicine. We're finding that all over the United States, physician offices are starting to finally wake up, and they're providing these new services, so our purpose today is to advise the public. Well, welcome, gentlemen, to today's show.
Thank you, Linda.
Thanks for having us, Linda.
All right, this first question I'm going to be giving to Dr. Koda. Now, Dr. Koda has been on before, and historically, he not only is an MD, he was a doctor, but he was also a colonel in the Air Force for many years. And it was when he was in the Air Force that he actually started to learn about acupuncture and to integrate it with his patients. And so, Dr. Koda, my question to you is, can you tell us from that point on, how did you start integrating acupuncture into your daily practice?
Well, Linda, I first got introduced to acupuncture just by chance. I was introduced to Dr. Richard Niemsau, who was a pioneer in the field, and he, we really thought he was just this crazy guy who did acupuncture and thought it was really pretty ridiculous that acupuncture would work. But he offered to see our patients, so he offered to see all the ones that we'd pretty much given up on, and he was able to fix quite a few of them. And I got to see some of my patients. I was just curious, when I had the opportunity, I would go in the room and when he was seeing some of my patients, and was quite astounded at percentage of time and the degree of benefit that they got. And I've mentioned in this forum before that, you'd have some patients saying things like, I haven't been without that pain in years. I don't know what it's like to live without that pain, or, I haven't felt this good in years, or, we'd throw in the book at them, and they really hadn't responded. So I figured I needed to do some of this, and I've always been looking for things to add to the practice, because really, as a family doctor, there's only so many options you have out there. There's physical therapy, and there's medicines, and there's narcotics, and there's only so many options. And when you're out of options, it's pretty frustrating. And most family doctors are pretty frustrated with, especially a lot of pain conditions and chronic pains and headaches and all those things.
Well, especially with the opioid crisis that's going on. I should add, to allow our audience to know, that Dr. Koda actually trained individuals to their medics to be able to integrate acupuncture out into the battlefield. So with that being said, if there was somebody that could be pretty seriously impaired, wounded, instead of IV narcotics, they would be using acupuncture. And we have another entire show that talks about this. But that is what had made pretty much a believer out of Dr. Koda, which now integrates acupuncture into his practice. Now, Dr. Halvorson, who is a doctor of chiropractic medicine, works with Dr. Koda in his office. And he's been a chiropractor for, I believe it's 30 years, and we're going to have all the information about his history and background that is going to be on the Seavine website. But he's a very knowledgeable and experienced individual. Dr. Halvorson, can you tell us briefly how chiropractic medicine works? What's the thought process behind it?
Well, as I contemplate that question, I have to preface it with the fact that I am not your typical chiropractor. I've been working with medical doctors for most of my career, and I found out a long time ago that they don't like the language that's used by typical chiropractors. I started working at a large medical group in Long Beach over 30 years ago, and when I came to put together some lecture material to do some education for the doctors, some of the younger doctors that were friends of mine looked at my little sheets that I'd put together, and I was going to talk about the subluxation, and they said, don't use that word. They said language matters. Medical doctors, particularly the older ones, don't like certain words in the language used by chiropractors. So I've had to change my terminology. I've kind of medicalized it over the years. My descriptions have been well received by the medical profession. I treat a lot of doctors. I treat a lot of nurses. So the chiropractors out there might think that I've kind of gone away from the profession a bit, but I've done it in a way so that I could build relationships and foster working with these medical doctors. So when someone says, how does chiropractic work? Back in the old days, chiropractors would talk about something's come out of place in your spine. There's pressure on the nerve and it's causing pain. And my goal as a chiropractor is I'm going to put it back into the right position. So it was more of a structural lesion. It was something comes out of place and we put it back in. And patients would come in all the time. My back went out again, and I was supposed to put it back in again. So that lingo I just wasn't comfortable with. And again, the feedback from the medical doctors was they didn't like that. So I did a lot of research. I've been doing this for over 30 years. I've been honing my skills and my language over the last 30 years. And I found some really good research done by medical doctors that work with chiropractors. So interestingly enough, it was a teamwork approach. Dr. William Kirkcaldy-Willis is an orthopedic surgeon. He is a medical school professor. He was a researcher and author, and he worked with the chiropractor Dr. David Cassidy in Canada. And they wrote the book, Managing Low Back Pain. And they describe beautifully the pathology of degenerative arthritis, osteoarthritis. So every patient that I see, I tell them, in general, the pathology that we're treating is arthritis in your spine, the old wear and tear arthritis that everybody gets. The spine is generally breaking down over time. And they talked about 3 major phases in the degenerative process, and they coined the phrase dysfunction was the first phase of arthritis. And it happens early on. A lot of times when you're a kid and you're a teenager, people will start to complain of back pain. And the arthritis process starts that early. In the process of dysfunction, though, the pathology is relatively minor, and a lot of times isn't seen on an X-ray or MRI. So when I used to give this lecture on degenerative arthritis and the phase of dysfunction, a lot of the doctors would come up after the lecture and say, I love to talk about how you take X-rays and you don't see any changes on X-ray, because they were frustrated. They would take X-rays, and a lot of patients, they wouldn't see anything. So I explain this to the patients. It's the phase of dysfunction. There's 3 major things in the phase of dysfunction that can cause mechanical dysfunction within the spine, and it's usually 3 things. I tweak the words so they all start with the letter S. I call it the 3 S's of dysfunction, and there's a muscular component, there's an inflammatory component, and there's a scar tissue healing component. So it's spasm and swelling and scar tissue. That's the pathology and dysfunction. And those 3 things can cause a restrictive forces where things start to tighten up and the joint actually can become locked. And when I've described this before in the lectures at this point, if I was talking to medical doctors, I would say, has anybody ever heard of the frozen shoulder syndrome? And everybody in the room would raise their hand. Everybody's heard of frozen shoulder when you're talking with MDs. So I said this pathology, the process of dysfunction characterized by spasm and swelling and scar tissue, is exactly like a frozen shoulder syndrome characterized by a joint that has lost its motion, it's become restricted and stuck. So chiropractors are biomechanical experts of the spine and of the extremities. We're joint experts. We palpate with our hands. We've been taught how to touch and feel, and we can feel tightness in the muscle. We can feel swelling and pain. We can feel scar tissue, nodules, trigger points in the muscles. And the main thing that we do is we do a little stress test to the joints of the spine. We go up and down the spine, and we're feeling for areas of fixation. And I tell people it's kind of a combination of spasm and swelling and scar tissue that can cause the joint to get locked up. So chiropractors will go up and down the spine with their hands, feeling for areas of restriction, and we treat it with what they call spinal manipulation. It's a gentle little thrust into the joint, and it's the effect on the spine is to loosen up the spine. It breaks up the scar tissue. It'll help reduce muscle spasm. It offers pain relief, sometimes immediate, I've done this for 30 years and have had incredible results where people who've had years of pain will look at me after the first visit and say, I feel unbelievable already. Just really, really nice results. So that is my short answer for what a chiropractor does.
Well, that was very well put. And actually, it was quite interesting, especially since you go at it from a little bit of a different perspective. Dr. Koda, this is something that I am hearing from a number of patients that do go to doctors that have chiropractics and acupuncture and et cetera. In order for chiropractics to be covered by insurance, there has to be an order from the patient's primary physician, which is basically where you come in. What exactly is the criteria that you look for when making a chiropractic referral, and how difficult is it to receive chiropractic medicine, have it paid for by your insurance?
Well, the traditional chiropractic conditions, which basically have to do with the spine, are pretty well covered. So if I know that there's something related to the spine or neck or back at all, then, I throw that in there, and I know that that will probably be covered. The ones that get a little bit dicey and, you just end up flipping the coin with the insurance company sometimes, has to do with other areas, other parts of the body, even, knees and ankles and other musculoskeletal areas that Jim had mentioned that, he's very comfortable with. And I think I'm comfortable with him treating those, but the insurance company, it doesn't always compute. So depending on, the day of the week or how bright the sun is outside, they may or may not cover that. So if there's some way to incorporate the fact that they also have low back pain or something like that, then we know that other part will probably be covered.
How do you decide what is the best avenue to take for somebody? I mean, do you have any type of what goes with what?
I think they can be complementary to each other, and I don't know that we have the perfect answer for that. One criteria that's very simple that I use is patient preference. They might be all for getting manipulated. They might have some relative walk on their back once in a while, and they, find good results from that. And so they're into chiropractic stuff. So I say, hey, fine, that's great. We'll go that way. Some people are okay with needles. Some people aren't okay with needles, and so that might make my decision as well. And so a large portion of it has to do with that, because I think in a lot of cases, either or will be very helpful for a patient.
Okay, that's excellent. Now, Dr. Halvorson, can you tell us a little bit about the patient's first visit? I mean, can a patient be helped with just one visit, or does it usually take multiple?
The first part of the question with the first visit, it depends on the chiropractor. Most of the time we take a history, we do an exam, we look for red flags. If there's any red flags on history and exam, I might order some diagnostic testing to rule out pathology. Most patients, in our situation where we're working together, the patients have already been seen by their medical doctors. A lot of times x-rays have already been ordered. And so most of the flags are eliminated and the patients get referred in. But then for me, I will put the patient down on the table, start palpating them, doing a spinal exam, and I start treatment on day one. Some chiropractors out in private practice, they will do x-rays, they will do their exam. They might wait until the second visit before they start the manipulation treatment. But I like to get it going on the first day. The second question, number of visits, it reminds me of a joke I heard. It was, how many chiropractors does it take to change a light bulb? And the answer is just one, but it takes 35 visits. You can insert the drum, the snare drum there. So visit number, I look at, like, if you're referred to physical therapy, the treatment is going to the physical therapist, and they're doing hands-on, they're doing exercises. So you have to physically go to them, and usually treatments will be 2 to 3 times a week for the first 2 to 4 weeks. And then depending on the response to the treatment, then there might be a weaning off. Chiropractic is the same way. I think just about all of us will see patients 2-3 times a week for a couple of weeks, and then start weaning them from care after that.
Now, I do know that I've had some patients ask that when you are like constantly cracking your knuckles, to use an example, the term that you use with manipulating,
Yes.
whatever it is you're doing with the spine, can't that in and of itself possibly cause arthritis?
Great question. And 30 years ago, I started a diplomate program at Los Angeles College of Chiropractic, and the first person that I heard lecture was Dr. Malik Schlossberg. And he said, hey, everybody's heard, Grandma telling everybody don't crack your knuckles because it's going to cause arthritis. And they actually did a study where they went to the nursing home and they got all these people that swore up and down that they were knuckle crackers all their life, and then they had a whole bunch of people that were not knuckle crackers. They took X-rays of the finger joints. They had the radiologist read the X-ray results, and it turned out that the people who constantly cracked and mobilized their knuckles all their life had much healthier joint spaces, and that the other ones, the non-knuckle crackers, had all the arthritis. So it actually proved Grandma was wrong, and mobilizing the joints periodically broke up the adhesions, broke up the fixations of the joint, decreased the progression of the arthritis.
That is fascinating. Oh, man, because I knew it always felt better when I cracked my knuckles. I'm one of those.
Just don't do it all the time. You can get hypermobile if you do it too much.
Well, that's good to know. Dr. Koda, is there any particular circumstances where you can think of it, you can integrate mainstream medicine, acupuncture, and chiropractic medicine all together as a particular treatment plan for any particular type of ailment or issue?
Of course. I'm probably one of the bigger proponents in this country of integrating all those things into basically normal medicine, primary care medicine. And so I think in many, many cases, patients will benefit from doing conventional medicine, doing acupuncture, and doing chiropractic all at once. So I don't make it an either or. If they want to have all those things together, shoot, they can have physical therapy all together too, because they all work in slightly different ways. And so you're potentially using the best portions of all those to hit the problem from a bunch of different angles. So I think it's great, and especially the way Jim does chiropractic. He does it in a fast, efficient way, which can be translated very well to other offices and other primary care settings, so that people aren't hurting in terms of their productivity and their bottom line.
Okay, excellent. Dr. Halvorson, this is going to be our last question for the evening because we're running out of time here. Is there anything a patient can be doing in between visits with you to help their treatment regimen along?
I'm so glad you asked that question. I've been a chiropractor for 30 years, and the thing I've heard a lot, patients come in to me, I might be a new chiropractor, and they always tell me the chiropractic treatment always helps. I always feel really good. And then they go home and it's temporary relief. Their pain comes back. So they're questioning me and wondering what can they do. And a long time ago, I came up with the idea of what if I treated my patients kind of like the dentist treated their patients and passed on some of the responsibility at home. So when patients come in, I tell them, I'm like your spinal dentist. When you come in, I'm going to do my thing. But when you go home, I want you to brush and floss every day. So we've come up with a little list of things. We call it brushing and flossing. And to me, those are three powerful little words because everybody knows what that means when they're talking about their teeth. It means at least once, not once a day, every day, but at least 2 or 3 times a day. And you're supposed to do it the rest of your life, and you're supposed to do it even when you don't hurt. So I tell people to brush and floss. And we've figured out a way to do massage and myofascial release using tennis balls in a sock, drop it over your shoulder and lean up against the wall and lean back and massage the tight little knots in your upper back and shoulder area, the lower back, the piriformis in the hip. the suboccipital muscles in the neck to try to keep the muscle tightness at bay. I teach the patients that the stresses of life happen every day, and it's going to tighten up the muscle every day. And if you brush and floss, if you roll your muscles out and stretch your muscles out and do a little strengthening once a week or a couple times a week, that you can go through life with a much healthier, happy back. But it starts with knowing that there's not a cure for the degenerative process. It's just like there's no cure for tooth decay. You got to get in there and you got to start doing a program that lasts a lifetime.
Excellent answer. All right, Dr. Koda, towards the end of our show here, I do have one other question for you. There are situations, and I've heard about this before, whether it is for acupuncture or even chiropractic. Somebody can take an X-ray, and they cannot see on an MRI or an X-ray, whatever the case is, anything wrong. And all the patient knows is they are in serious pain, or there's not any doubt in their mind something's up. But you can't see it on an X-ray or an MRI or anything to this effect. What are your thoughts about that? How do you deal with circumstances like that when traditional medicine is all about you only implement treatment because of a proven seen anomaly?
Well, what Jim was saying about chiropractic and especially early disease really resonates with acupuncture as well. You know, he's talking about all the cases where the MRIs look okay. You know, they're fine. He manipulates them. They feel a lot better. Well, that is exactly what I love about acupuncture. I love those cases. You know, you get people, they get their MRIs of, you know, some limb or some part of their abdomen, and you know they get it back and it's normal, and they go to the specialist, you know, who's the expert in the field, and they say, well, there's nothing there. That means that it's not going to kill you. You know, have a nice day. And the patient's sitting there dumbfounded and going, yeah, but you didn't fix my problem. I still have this pain. And a lot of times, you know, in acupuncture, I love those cases because I can fix those. You know, maybe we're not smart enough in 2018 to know exactly what it is, but I can help those. And it's sort of the same way with chiropractic. You know, a lot of those times where, hey, those MRIs of the neck or the back look okay, but the patient's in a lot of pain, and they can help those a lot.
Can I interject one thing, Linda?
Sure.
Please.
Yeah,
Go
just
ahead.
kind of reiterating what I'd said, with the pathology of degeneration, especially with the first phase in dysfunction, the main pathology is spasm and swelling and scar tissue. And I tell my patients, you cannot see muscle spasm on an X-ray or an MRI. You can't see swelling on an X-ray or an MRI. You don't see scar tissue on an X-ray or an MRI. Just because you can't see it doesn't mean it's there. And it's something that I tell her, we can palpate. Massage therapists, osteopaths, physical therapists, chiropractors, we can feel the tightness in the tissue. We can feel the trigger points in the muscle. We can feel areas of restriction where we'll do manipulation. So just because you can't see it, it doesn't mean it's there. We might be able to pick it up with other senses like touch.
Outstanding answer, both of you.
Thank you.
Well, I want to thank you, Dr. Jim Halvorson, for joining us this evening, and to you, Dr. Erik Koda. You guys, as usual, are fantastic. I love having you on. Now, I want everybody to be certain to join us next week, where we are going to be having a show with Dr. Erik Koda and the chief of the Temecula Fire Department. And we're going to be having a very interesting discussion about how there's a possibility to integrate acupuncture in with paramedics who stop at very bad accidents and et cetera, to be able to implement that for pain just like they do in the military on the battlefield. So again, thank you for joining us tonight on the Wholesome Pharma Channel, the C-Fine News Network, and we will talk to you next week.